Hey everyone, welcome back to our podcast. Today, Joy and I will be speaking on America's war on drug. For a little bit of context, the war on drug in the United States officially began in the 1970s, but its roots trace back to earlier periods of drug regulation and public perception. The term war on drugs was popularized by President Richard Nixon, who in June 1971 declared drug abuse public enemy number one. This declaration marked the beginning of an aggressive campaign against the illegal drug trade. Nixon's administration framed drug addiction as a major threat to American society, tying it to crime, violence, and social decay. Some key legislations are the Controlled Substances Act of 1970 and the creation of the Drug Enforcement Administration, also known as the DEA. The Controlled Substances Act of 1970 established the modern system of drug regulation, classifying substances into 5 schedules based on their potential for abuse and medical value. The act created the framework for federal drug enforcement. The DEA was established by Nixon in 1973 to consolidate efforts to enforce drug laws and coordinate with state and local authorities. The war on drugs escalated during the Reagan administration. President Ronald Reagan significantly increased funding for drug law enforcement and promoted a zero-tolerance approach to drug offenses. The Anti-Drug Abuse Act of 1986 introduced mandatory minimum sentences for drug offenses, leading to a substantial increase in incarceration rates for drug-related crimes. The act also established the disparity in sentencing between crack and powder cocaine, which disproportionately affected African American communities. The 1990s saw a continued focus on strict drug enforcement under both Republican and Democratic administrations. The Crime Bill of 1994, signed by President Bill Clinton, included provisions that furthered the tough-on-crime approach, including the 3 strikes rule. The 3 strikes rule imposed life sentences for repeat offenders of serious crimes, including drug offenses. So, as we've seen, the war on drugs has had a long and complex history, marked by shifting policies and evolving strategies. While the focus initially was on substances like marijuana, cocaine, and heroin, the landscape of drug abuse in America has changed dramatically in recent years. One of the most pressing and devastating aspects of today's drug crisis is the opioid epidemic and fentanyl.
The opioid crisis in the Americas, particularly in the United States, has been a significant public health issue over the past few decades. And just for some background information, the crisis began in the late 1990s with the overprescription of opioid pain relievers. Pharmaceutical companies assure the medical community that patients would not become addicted to opioid pain relievers, leading to widespread prescription. And as prescription opioids became more regulated, many individuals turned to illicit opioids like heroin, and more recently synthetic opioids such as fentanyl. And this has caused an astounding impact on our community. There has been a sharp increase in opioid addiction and overdose deaths. According to the Centers for Disease Control and Prevention, nearly 841,000 people have died from a drug overdose since 1999, with opioids involved in nearly 70% of those deaths in recent years. Along with this, the economic burden of the opioid crisis is substantial, including healthcare costs, lost productivity, addiction treatment, and criminal justice involvement. A study by the CDC estimated the total economic burden of prescription opioid misuse in the U.S. at $78.5 billion per year. Now we're going to be looking at some of the contributing factors that led to this. So, inappropriate prescribing practices contributed significantly to the crisis. This included overprescription and lack of proper patient education regarding the risks of addiction. And similarly, high levels of poverty, unemployment, and lack of education in general can contribute to higher rates of substance abuse. Areas with fewer economic opportunities often see higher rates of opioid misuse. And overall, there's just a strong link between mental health issues and substance use disorders. Many individuals with untreated mental health conditions turn to opioid as form of self-medication. And as for the current situation, the opioid crisis continues to evolve, with synthetic opioids like fentanyl contributing to a new wave of overdose deaths. The COVID-19 pandemic exacerbated the crisis with increased isolation, economic stress, and reduced access to treatment services, leading to a rise in overdose deaths. Now, diving deeper into the opioid crisis, we're going to be talking about the rise of fentanyl, which is a major driver of the opioid crisis that marks the third wave of the epidemic. So, fentanyl is a synthetic opioid that is 50 to 100 times more potent than morphine, making it highly effective for pain management, but also extremely dangerous when misused. And as for how it began spreading, fentanyl began significantly impacting the opioid crisis around 2013. Initially developed for medical use, illicit fentanyl soon appeared on the black market. It's often mixed with other drugs such as heroin, cocaine, and counterfeit prescription pills, leading to unintentional overdoses. And illicit fentanyl is primarily produced in clandestine labs using precursor chemicals often sourced from China and manufactured mainly in Mexico. It is then trafficked into the United States, contributing to the widespread availability and increased overdose deaths. And due to its high potency, even a small amount of fentanyl can be lethal. This has led to dramatic rise in overdose deaths, with fentanyl now responsible for the majority of opioid-related fatalities. In 2022 alone, there were approximately 73,838 deaths from synthetic opioids, primarily fentanyl.
Now let's focus on the legalization and discrimination aspect of this war. The conversation around drug legalization has gained significant momentum in recent years. States across the US and countries worldwide are rethinking their approach to drug policy. The shift from criminalization to legalization is driven by several factors, the first one being economic benefits. Legalizing drugs, particularly marijuana, has opened up new economic opportunities. Tax revenues from legal cannabis sales have provided substantial financial benefits to states, funding public services and infrastructure projects. The second one being public health. Legalization allows for regulation, ensuring safer products and reducing the risks associated with black market drugs. It also opens the door for more comprehensive harm reduction strategies, such as safe consumption sites and wider access to addiction treatments. The last one being criminal justice reform. Legalization reduces the burden on the criminal justice system, freeing up resources to tackle more serious crimes. It also mitigates the issue of mass incarceration, particularly for nonviolent drug offenses. However, while legalization is a step forward, it doesn't fully address the deep-rooted issues of discrimination in drug policy enforcement. The war on drugs has disproportionately targeted minority communities, leading to significant social and economic disparities. Here's what we need to consider. The first one being racial disparities in arrest. Despite similar rates of drug use across racial groups, people of color, especially African Americans and Latinos, are more likely to be arrested and incarcerated for drug offenses. This has far-reaching consequences, including disrupted families, economic instability, and a cycle of poverty and incarceration. The second one being sentencing disparities. The crack versus powder cocaine sentencing disparity is a prime example of how drug laws have unfairly impacted minority communities. The harsher penalties for crack, more commonly used in African American communities compared to powder cocaine more prevalent among white users, have led to long-term social and economic harm. The last one being reforming policies. Addressing these disparities require comprehensive policy reform. This includes revisiting sentencing laws, expunging records for nonviolent drug offenses, and ensuring equitable access to emerging legal drug markets. Initiatives like the MORE Act, which aim to decriminalize marijuana at the federal level and address the racial injustices of drug policy, are a step in the right direction.
The war on drugs has been largely ineffective in achieving its goals of reducing drug use and trafficking. The persistent availability of drugs and the ongoing opioid crisis underscore the need for more nuanced and effective approaches. And the aggressive law enforcement strategies have also had significant negative consequences, including mass incarceration, racial disparities in the criminal justice system, and substantial social and economic costs. These outcomes have prompted calls for reform and a reevaluation of drug policies. So, in conclusion, while the war on drugs have had some successes, its overall impact has been limited and accompanied by significant social costs. The evolving approach towards treating drug addiction as a public health issue offers a more promising path forward.